Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, e.g. labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Internet high five from an oncology patient, thanks for doing what you do. Chiming in to agree with the other poster. My son had cancer and his DRS were amazing and kind. You really look to your oncologists for answers, and sometimes, hope. So, thank you for what you do. I don't get involved in the management. I let the doctor seeing me lead that, unless they missed something huge, and I would just double check. The main difference is I can present the whole history and relevant info in about 30 seconds flat, and the doctor with that info can just give me the management plan in about the same time. Fastest consultations ever. Very methodical. Oh man, I'd like to be able to do that. I have a pretty extensive medical history, and with new MDs I go in with a type up, but I'd love to have an elevator pitch down. I think it takes me about 2 to 3 minutes currently. 2 to 3 minutes is great, Oswell. It beats the patient who has a 10-minute slot and tells you about their pet cat for the first 5, haha. Or the patient who denies their own medical history. Do you know or have you ever had any heart problems? No. What's that scar on your chest from? My triple bypass. Ag. The classic. Do you any medical conditions? Know what medicines are you on? Ramipril? Facepalm. Management plan, getting to a healthy weight will help same patient. Dr. I'm not stupid, let's not state the obvious. Me and me head, really? And do you smoke? No. Have you ever smoked? Yes. When did you quit? Tuesday. Me, you just said you're on Ramipril, but you said you have no medical conditions. Are you sure you don't have high blood pressure? Patient, I don't have high blood pressure. The tablets made it disappear. LOL. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say, derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC. Real question is, do you understand the prescription the other doctor writes? We don't really write prescriptions much anymore, usually it's computer generated. My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds etc., then yes, they do discuss stuff like it's a group project. How was it growing up for you? Did she get over every little ache and pain, or were you just told to walk it off because she's seen so much worse? Asking because I know experiences from both sides. My grandparents were both physicians and lived with us while I was growing up. Grandma was a pediatrician and Grandpa was a surgeon. Anytime I had an ache or felt sick, she would examine me, then go to her bathroom medicine tablet and bring back medicine in a little paper cup. It always made me feel better. I later found out it was always a children's Tylenol. She was faking me out with the placebo effect. If I was actually sick, my grandma would have my mom take me to another doctor, as she was no longer practicing and couldn't order tests or prescribe medication. That's actually super sweet and adorable. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part, they're pretty good patients because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk or I simplify medical terms for laypeople. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, "My aunt is a nurse, and she said I need a whole body MRI for this runny nose." As far as self-diagnosing, I usually deal with my own minor medical issues. If I notice signs of something more serious, I would go to someone else. As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we're not the same and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk though. These are folks that can understand medical terms, and I don't want to be demeaning, but I've got my dumbed down spiel about things and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor too. Although when I went in for surgery last year I had a great time chatting with the anesthesia nurses about protocols until they drugged me. I'm also a vet, and I usually don't even tell my doctors what I do. I once let an endocrinologist go through a whole explanation of what hyperthyroidism is to me because I didn't want him to accidentally skip over something that's different between humans and cats. Turns out it's pretty much the same. And in the end, I don't have it.